Welcome to Science Force, where science comes alive.
Hello everyone and a very warm welcome to today's explainer. Today we are diving straight into a microscopic miracle located right inside your neck. I'm talking about the thyroid gland. It's so small, yet it wields an immense amount of power. When it's functioning normally, it acts as the silent conductor of your body's symphony. But what happens when this tiny gland goes into overdrive and completely hijacks the entire body? Well, that is the fascinating condition known as hyperthyroidism. Alright, here's our roadmap for today. We'll start with the butterfly effect, move into the disrupted hormonal axis, and then explore the body in overdrive. After that, we're solving the medical puzzle, restoring the balance, and finally, preventing the storm. Let's get right to it. First up, Section 1, the butterfly effect. So, what exactly is hyperthyroidism? Simply put, it's a disorder where your thyroid, which is this small butterfly-shaped gland sitting just below your voice box and wrapping around your windpipe, basically goes rogue and releases excessive amounts of thyroid hormones. For those of you just getting into this, you can think of the thyroid as your body's master thermostat. It regulates your metabolism, your energy levels, and even your body temperature. And for the life science and medical students tuning in, here's the biochemical breakdown. Your thyroid extracts iodine from the food you eat to manufacture two absolutely crucial hormones, T3 and T4. Hyperthyroidism is simply the state where the gland overproduces these hormones, putting your entire metabolic engine into severe acceleration. Moving on to Section 2, disrupted hormonal axis. Okay, let's trace the steps of the hypothalamic pituitary thyroid axis, or the HPT axis for short. It all starts up in the brain. Step 1, the hypothalamus releases TRH. Step 2, that TRH signals the pituitary gland to release TSH, which stands for thyroid stimulating hormone. Step 3, TSH tells the thyroid gland itself to pump out T3 and T4. Now, the absolute beauty of this system is its negative feedback loop. In normal conditions, when you have enough T3 and T4 floating around, your brain senses it and just decreases the TRH and TSH. It basically turns the tap off, right? But in hyperthyroidism, this brilliant control mechanism is completely disrupted, and the hormones just keep on flowing. And as we break down the causes of this disruption, one thing becomes incredibly clear. While there are a few smaller culprits like toxic multinodular goiter, which involves autonomous nodules common in older adults, or thyroiditis, where inflammation just dumps stored hormones right into your bloodstream, the vast majority of cases come down to one massive factor: Graves' disease. It is by far the most common cause of hyperthyroidism, and it's actually particularly prevalent in women. Let's really demystify Graves' disease here, because the biological mechanism is absolutely fascinating. In a normal balanced system, TSH regulates everything perfectly. But in Graves', it's an autoimmune condition. The patient's own immune system starts producing these rogue antibodies called thyroid-stimulating immunoglobulins, or TSI. And here's the crazy part. These TSI antibodies perfectly mimic TSH. They lock onto the thyroid and completely hijack it, constantly stimulating the gland to produce excessive amounts of hormone. Because the gland is working so incredibly hard, it physically enlarges, which causes a goiter in the neck, and famously, it can even cause the eyes to bulge out. That brings us to Section 3, the body in overdrive. Now let's walk through this systemic breakdown. When you have excess thyroid hormone, it cranks up your sympathetic nervous system activity and cellular oxygen consumption across the board. I mean, literally every single tissue is affected. General, patients experience severe heat intolerance and excessive sweating. Cardiovascular, the heart becomes highly sensitive, causing tachycardia, where your heart is just racing, along with palpitations. Nervous system, this overdrive translates to severe anxiety, irritability, and fine hand tremors. GI tract, even the GI tract speeds up, leading to frequent bowel movements. Plus, your muscle proteins are actually being broken down faster than they're built, which causes profound debilitating weakness. We actually call these the paradoxes of overdrive. Just imagine losing weight despite eating everything that notices you, or having a resting heart that is beating over 100 times per minute while you're sitting completely still. Now look, losing weight while eating everything in sight might sound like an absolute dream scenario to some, but clinically, let me assure you, it is a major medical red flag. It literally means the body is effectively consuming itself. Section 4. Solving the medical puzzle. So when a patient walks into the clinic, what exactly is the doctor looking for? Well, they look for a very specific cluster of physical signs. They'll feel the neck for a goiter, that enlarged thyroid gland we talked about. They'll ask the patient to hold out their hands to check for those fine tremors. They'll check for a rapid pulse. But perhaps the most visually striking sign, particularly in Graves' disease, is exophthalmos, which is protruding eyes. This happens because the tissues directly behind the eyes become heavily inflamed and actually push the eyeball forward, leading to dry, painful, and very red eyes. Now, for the medical students tuning in, you absolutely must remember this paradoxical laboratory signature. When testing, you're going to see a very low, almost completely undetectable TSH right alongside highly elevated T3 and free T4. And why is that? It's because the brain is desperately trying to shut off the thyroid by dropping TSH to 0. But the rogue thyroid is just ignoring the brain entirely and pumping out T3 and T4 anyway. So, a suppressed TSH with high thyroid hormones, that is your definitive diagnostic signature. Alright, so the diagnosis is confirmed. The body is effectively trapped running a marathon it never even signed up for. So the critical question we have to ask ourselves now is, how do you cool down a body that's constantly running this physiological marathon? And that leads us to section 5, restoring the balance. Clinically, we essentially have 3 main lines of intervention. 1. Anti-thyroid medications like methimazole or propylthiouracil. These actually physically block the gland from synthesizing the hormones in the first place. 2. Radioactive iodine therapy. Because the thyroid is totally unique in how it absorbs iodine, we can actually give the patient a radioactive version that gets absorbed and then selectively destroys the active tissue. It's highly effective and non-surgical, though it does often result in the patient needing lifelong hormone replacement afterwards. 3. Surgery, thyroidectomy, where part or all of the gland is physically removed. This is usually reserved for very large goiters or especially severe cases. Crucial note: it is important to understand the distinct roles of the medications used. Antithyroid drugs actually stop the hormone factory itself. They solve the root biochemical problem. On the flip side, we have beta blockers like propranolol. Beta blockers provide fantastic rapid relief. They slow down the heart rate, stop the tremors, and calm that intense anxiety. But remember, they do absolutely nothing to reduce the actual thyroid hormone levels in the blood. They just shield the organs from the effects. Both have vital, but they serve very different roles in treatment. Section 6. Preventing the storm. We have to talk about the most terrifying complication of all this, a thyroid storm. It is rare, but make no mistake, it is a catastrophic medical emergency. It's the absolute endpoint of unchecked, untreated hyperthyroidism. The body goes into complete overdrive, presenting with a dangerously high fever, extreme tachycardia, delirium, heart failure, and eventually shock. Without immediate aggressive emergency treatment, a thyroid storm can absolutely be fatal. But let's definitely end on a positive, actionable note here. All of those severe complications are entirely preventable. If you are in a high-risk group or you have a family history, regular thyroid screening is key. For those who are diagnosed, proper medication monitoring and early treatment keep the body in perfect harmony. And one more important tip: avoid taking unnecessary dietary iodine supplements unless directed by a doctor, as they can actually trigger the condition in susceptible individuals.
It truly is amazing, isn't it? If a single gland, roughly the size of a tiny butterfly, has the sheer power to completely dictate the rhythm of your entire body, to alter your heart rate, your weight, your very mind, well, what other microscopic miracles are quietly steering your life right now? Biology is profoundly beautiful. Thank you so much for exploring this topic with me today, and I hope you leave this explainer feeling just a little more in awe of your own wonderful body. Keep learning and take care.
Thank you for watching Science Force. இன்று ஏதேனும் ஒரு புதிய விஷயத்தை கற்றுக்கொண்டது உங்களுக்கு மகிழ்ச்சி அளித்திருந்தால் மறக்காமல் லைக், ஷேர் மற்றும் சப்ஸ்கிரைப் செய்யுங்கள்.